Come on, up on the magic bus with me, and let's hit the high road. All right, guys, we're here. What do you say, huh?
Take the high road. Come along with me on this high road.
Hey, it's Jack Maxwell. Thank you for joining me on the High Road callback discussion. What you just saw was the very first episode of the High Road with Jack Maxwell, full title. We'll do it at the same time every Friday night. We cover the political side, the legal, the economic, the medical. Speaking of which, we have on the show tonight Dr. Dr Torres, who is the first medical professional to say, hey, have you thought of CBD for what you're going through? So we're going to play a little clip from her on the show, and then we're going to speak with her on the other side. Stay with us. So let's start by going back to the day my doctor put this idea in my head.
How's the chemotherapy going?
I was on the back end of chemo treatments for non-Hodgkin's lymphoma, and now going back every other month for a tune-up. But still, I couldn't sleep. On the recommendation of a friend, I started taking CBD oil.
Okay.
And he said it will help you sleep. And I'm not a cannabis user.
My goal is to make you comfortable.
That's my goal too, to be comfortable, please.
I think CBD and even medical marijuana can be a useful alternative.
Really? Because I know a lot of people who've been getting high for years and told me one day this is going to be considered medicine, and I would laugh at them.
Absolutely. I know a lot of patients that have actually discontinued using their opiates because they found more benefits with CBD.
Okay, we have Dr. Dr Torres with us. Hi, Doc. Thanks for being here.
Hi, Jack. How are you?
I'm doing great. How about you?
I'm great. Thanks for asking.
Where are you? Are you in Deep Space Nine? What is that all that stuff behind you?
I had procedures today, so I'm here at my procedure suite.
Speaking of, that's how we met. I was going through quite a bit of pain from my cancer, non-Hodgkin's lymphoma, and my chemo treatments. I came to you, and you created a comprehensive approach to what I was going through. But one of those things, of course, was your suggestion of CBD and medical THC or medical marijuana, and which I found fascinating, of course, because I couldn't imagine a doctor saying that 10 or 20 years ago, maybe even 5 years ago. So I know you did it for a reason, because you feel that it helps and you've seen results. Can you share those with us?
Sure. Well, I've been practicing pain management for about 10 years now. And I'm always looking for alternatives or treatment options for my patients that have debilitating chronic pain. And it wasn't until the last, I would say, 2 years that I've had discussions with my patients about CBD in particular. And over the last year, a lot of my patients are asking me about it because they've been reading online or they've been seeing products in grocery stores regarding CBD. Some of the conditions that it helps can range from chronic debilitating fibromyalgia, which is pain throughout the entire body. It may feel like pins, needles, stabbing sensation. Patients with neuropathy, which is pain in their feet, that can feel like sharp stabbing, burning pain. Patients with chronic back pain, neck pain, joint pain related to osteoarthritis. The list goes on and on. If you can think of any pain condition, CBD has been helpful in my practice.
That's funny. I had a couple of those things you said. One of them was neuropathy, very serious nerve pain. And I'm so glad I came to you for a lot of reasons, of course, because I feel so much better now. So when did that turn for not only for medicine, but for you personally?
Well, there have been some studies, although limited to rats, that compared opiate analgesics to CBD, and there was a benefit. It seemed that in a lot of my patients that had been on chronic opiate therapy, their pain score just was always an 8 out of 10. It was always chronic, debilitating, severe pain. So when I read this article and when I had discussions with my peers about it, I thought it would be interesting to add it to their therapy and see if that would change their pain level, which it did. In fact, some patients actually discontinued their opiate therapy because the CBD was so beneficial.
I know, though, there's got to be pushback from, I'm sure, people you work with, certainly people in the medical community saying it doesn't work or it's no good or it's dangerous or not enough studies or no scientific evidence. So what have you heard as far as that goes?
Well, of course, I practice evidence-based medicine, as most doctors do, and there's not enough randomized controlled trials on CBD and medical marijuana. Most likely because there's lack of funding in this area. It's new, and a lot of physicians may feel a little hesitant to start certain patients on this treatment because of their medical conditions. So I always advise anybody considering starting CBD or medical marijuana to have the discussion with their physician, because their medications may interact with it, or they may not be an appropriate candidate for it.
And I completely understand wanting to do randomized testing and control and double blind, all of these things, very important. You don't want to just say, go take this. And yet still people will say that there is zero scientific evidence. But when you have this much anecdotal evidence, I mean, doesn't it start somewhere? At what point do you say, okay, maybe this is an option?
Well, I've had discussions with my patients over the last 2 years, and I would say that overwhelmingly majority of patients do very well with CBD in addition to their treatment plan that I have with them. But there are some patients that don't benefit from it, and it could be a number of reasons. One is that they're not consistently taking the CBD. Either it's too low of a dose, they need to increase their dose, or the product is not pure. So there isn't a standardization of any of the CBD products. The FDA does not regulate CBD because it's a supplement. And so therefore you're going to get various results from the different products on the market. So I always encourage my patients to do research on the manufacturer, on the company that produces the CBD, and to try different products, to try different doses, and of course, before starting anything, to have a conversation with their doctor about it.
Of course. I'm glad you brought that up, though, because I know that so you can have two different people take the same amount and get different results, depending on, first of all, what it is they're feeling. And then, of course, because of their cannabinoid receptors. Can you go into the science of that, or the medicine of that, how that works exactly inside our bodies?
Sure. We all have the endocannabinoid system. We have cannabinoid receptors on our cells, in our brain, peripheral nervous system. And in fact, it's actually the highest number of receptors in our body are cannabinoid receptors. However, cannabidiol, or CBD, has a very short half-life. So we produce cannabidiol in our system, and it regulates homeostasis, or balance within our body. It's like yin and yang. So if anything is out of balance, if there's ever an injury, there is a short burst of cannabidiol that's released in the system. However, it's a very short half-life. So therefore, if we supplement with CBD products, we would hope that in theory, we would reach a more homeostasis or balanced state, which would mean less pain, less disease, less symptoms.
Speaking of pain, I want everybody to know Dr. Torres is a pain doctor. And that is one of the things, not only from my travels on the high road, but also through the medical community, that I discovered it's really effective for pain because of inflammation, et cetera. Right, Doc? Is that what you found as well?
Absolutely. Absolutely. I would say a majority of my patients supplement the treatment with me with CBD. And
something you told me when we were filming that I don't think made it to the show, you have found that it in some cases, certainly not all, and I don't know how many, maybe you can be specific about that, but in some cases, patients who have gotten off opiates and are just treating themselves with CBD or CBD, THC, full spectrum, whatever that is. I don't want to put words in your mouth. Can you explain?
Yes, I've had patients who voluntarily came to me, told me that a friend of theirs had received benefit from CBD and they wanted to try to see if they could stop their opiate therapy. However, with the direction of a physician, right? So I helped them reduce their dose of opiates over a period of time gradually, and while they were supplementing with CBD and medical marijuana. And I was actually amazed and actually very happy to see that my patients had an improved quality of life. They had less pain. They had the life that they had only dreamed of. And it was awesome to see it come to fruition.
So what do you think the future is? Because just like with alcohol, there was the temperance movement, and for years they tried to get alcohol prohibited. They finally succeeded from 1920 to 1933, and then of course that fell apart. I know there's great pushback here, maybe from big pharma and others, but for me, and I could be wrong, I think the genie's out of the bottle. I only see us progressing as far as the science of it, the research on it, people using it and discovering what it can or can't do. How do you feel about that?
Well, I believe the future is positive when it comes to CBD and medical marijuana. We do need more trials. We do need more randomized control studies.
I get some friends who would volunteer for some.
The problem is we don't have a standardized dose. There's no standardization of the CBD products. I believe that it is coming in the near future. I believe that it is possible. And I know that so many patients would benefit from this treatment if it were standardized and if it were something that the medical community came behind and supported, so that way we could have more funding for this purpose.
You know, I know a lot of people who have played sports, most of it, like myself, most of their lives. As they get older, they get a little more banged up, they're a little more sore doing things that they used to do and they were fine. Now it takes a little while to recover. And I know a lot of people are using salves or jellies or creams or whatever with CBD or maybe CBD THC and getting great results. As a matter of fact, the very next episode of The High Road, we talked to a former NBA basketball player who found it so effective, he started a company and named it after his grandmother. So I'm very much looking forward to that. And I thank you for your time. I appreciate it. Not only being on the high road, but being on the high road callback discussion with us right now. Thanks, Doc.
My pleasure.
All right, that does it for tonight. Thank you for joining us and hope to see you again as the journey continues on the high road.